Hello, my name is Emily Tersigni, and I'm a third-year nursing student at Eastern Michigan University. I've been working with Dr. Hughesdon in order to bring you this presentation today. I was supposed to present this at the Undergraduate Symposium, but due to the recent pandemic, it has been canceled, so I'll be bringing you a recorded online PowerPoint format. Today I'll be discussing a scope and review of emotional childhood abuse, so please stay tuned. The order of this presentation will be as followed. First, we'll define the different types of childhood maltreatment, and then we will discuss the definition and criteria of emotional childhood abuse. Negative outcomes will be presented, followed by post-traumatic growth, and then we will conclude this presentation. Physical child abuse is defined as injury inflicted on a child with malicious intent that is non-accidental. Sexual child abuse is defined as acts of sexual exploitation or involvement of a child in sexual activity, and these are both taken from the Child Welfare Government website. Both of these forms of abuse have immediate consequences on the child. Evidence of these forms of abuse can be identified through visual and physical exams. It is difficult to understand what qualifies as emotional abuse due to the lack of standard definition. This lack of standard definition disrupts the ability to identify, prevent, and treat those who have been emotionally abused. And this lack of definition is largely due to the amount of gray area within this definition of emotional child abuse. There are many disagreements into what qualifies, and it's very hard to determine isolated versus chronic cases of emotional child abuse, which we will discuss later. Due to the lack of physical evidence, it is extremely difficult to understand and identify those that have been emotionally abused. It is impossible to diagnose short encounters, as fleeting moments of anger or outbursts by a caregiver is not considered emotional abuse. It is the chronic nature that becomes abusive, and malicious intent is not always involved. There is agreed upon criteria by many healthcare professionals and social workers. It involves acts of parents and feelings of the child. And as stated on this PowerPoint, I have separated into caregiver and child criteria. To summarize, the child is not recognized, respected, or valued and is made to feel useless and unimportant. The child is often demeaned, frightened, and rejected. This behavior by the caregiver is constant and repetitive and can also escalate. Some of the examples of this could be a caregiver constantly screams at a child without warrant. A caregiver with a drinking problem gets drunk and yells or threatens a child multiple times. A caregiver spends all their time on the computer and doesn't pay any attention to their child. The caregiver tells the child they're not good enough because they're not the best at something. And following a divorce, a caregiver asks the child to lie about the other caregiver in order to get full custody, or pins the child against the other caregiver. We'll now discuss the negative outcomes of the emotional child abuse. Many children that have been emotionally abused develop mental health issues following the abuse. These can include, but are not limited to, depression, alcohol and substance abuse, anxiety, eating disorders, disassociation, suicidal thoughts or ideas, increase in risky behavior, and social phobias. They can also develop trust issues, have marital dissatisfaction, have difficulty recognizing or expressing their own emotions, and can also have attachment issues and relationship insecurities. Post-traumatic growth is a term used to describe those that have survived trauma and thrived after. There is now evidence that those affected through childhood maltreatment have increased resilience and protective factors. This means that the child has an increased ability to overcome adverse experiences later in life. The survivors can show increased problem solving, greater education, increased flexibility, increased intelligence, increased talents, and more. Childhood emotional abuse is very hard to define. Due to the nature of these cases, it's also very hard to diagnose and treat these children. I hope from this presentation today you have a better understanding of what childhood emotional abuse is and the possible outcomes for the children. It'll take more than this presentation today to start making changes, but the more people that know are involved, the better a chance we have of helping these children. I have also included Eastern Michigan University's counseling and psychological services information after this in case you feel distressed and would like to talk to somebody. And as part of my research, I will also be sending out a short survey for people to fill out. So if you're interested, please contact me and let me know. Thank you.